आप सब जानते हैं कॉकलियर इम्प्लांटेशन के बारे में. Almost many people nowadays are aware that there is a surgery called cochlear implantation, mostly for children who are born deaf or who become deaf unfortunately because of trauma or some meningitis and other disorders, but is also applicable to adults and our elderly population who are not able to achieve any benefit with the hearing aids. Now, though cochlear implantation is now done world over at many centers, there are still a lot of people, children especially, in whom cochlear implantation is particularly complicated because of either anatomical deformities, these children have genetic abnormalities, or they have meningitis because of which their cochleas are ossified and there is no normal anatomy. Also, in some patients, children or adults who have had fractures of the ear bone in road traffic accidents or assaults, and they have lost their hearing unfortunately. These are all candidates for cochlear implantation. Coupled with that, now we have many children who have been implanted some years back, 5 years or 10 years back, but because of some unfortunate incident, trauma, or because of infection, their implants are rendered useless. They are not able to obtain any benefit with their cochlear implantation. One shouldn't lose hope. There are many such patients who either require revision cochlear implantation or who require a cochlear implantation in case when the cochlea is ossified, in otosclerosis when it has to be drilled. These are highly complex and precision procedures where there is absolutely zero scope for error. One cannot overshoot or undershoot in these patients. These patients require strong planning for surgery, whether they can be implanted. Their antibiotic prophylaxis is different. Their vaccination protocols are different. Their switch-on protocols are different. And most importantly, their surgery is to be handled by very high-end surgical teams who are apprised in this kind of work. So if you are somebody or you know somebody who needs a cochlear implant but is concerned regarding the status of the cochlea, which is ossification or trauma, or because there is an implant that is not working and it needs to be replaced, you are a candidate for revision implantation and looking where you can go, then you should come to us so that we can take this forward. Every patient of revision cochlear implantation and cochlear drill out is different. It's not same. Every patient will require some investigations before which we can point out that yes, these are the patients who will highly benefit from surgery. And if surgery is to be done, then we require very high-end precision tools such as high-quality operating microscopes, surgical drills, navigation surgery, where despite multiple revisions, we are able to pinpoint what is our landmark, where is the cochlea, so that we can avoid complications at all cost.